great to be here, and when I arrived, I couldn't believe how many people were streaming out of this room. So, all giving up your Saturdays for a really interesting day. And that presentation was fantastic. I'd like to go to your clinic and be treated by all of you. And I love that idea of having a supportive environment, because that's very much what the Obesity Policy Coalition is involved with, trying to create an environment that makes the healthy choice the easy choice. And there's a lot of different ways of doing that. And clearly you all play a really, really important role. And I'm going to challenge you to sort of take yourself away from the client relationship and use your influence a little bit more broadly. So I'm going to start with talking a little bit about the Obesity Policy Coalition and the work that we do, and how we kind of got into the dental health space because of something done by Coca-Cola. But I'll just take a step back. The Obesity Policy Coalition is a collaboration of Cancer Victoria, Diabetes Australia Victoria, Vic Health and Deakin University, and we're advocating for policy and regulatory reform to prevent overweight and obesity. But we also get involved in a lot of partnerships and other work that goes on, and we're linked in, as is DHSV, with the Rethink Sugary drink campaign. So I'll just talk a little bit about how I learned quite a lot about sugary drinks in a very short period of time when Coca-Cola put this advertisement in the newspaper. I don't know if you remember this. It was 2008. It was pretty shocking. Even someone from the Australian Competition and Consumer Commission said, yes, we were a bit concerned when we saw that. Now, we felt that this was misleading and deceptive conduct. I didn't think that. I worked with a lawyer who said they were pretty sure that that would be seen as that. And I note that Kerry Armstrong's career hasn't really taken off since she did this ad campaign. And it was probably a bit of a misstep. But she became Mum the Mythbuster. She had teenage boys, and she was going to tell mums why Coca-Cola was not as bad as they thought. And they knew Coca-Cola did some surveys with mothers in particular, and these were the concerns that they very rightly raised about giving their children Coca-Cola. We'd had a little bit to do with Coca-Cola about some of the mistakes that they'd made that made us concerned, but this was pretty serious. So we worked with the Australian Dental Association, and these were two areas that we were particularly worried about, that it was a myth that Coca-Cola made you fat. And with the dental statements, we were really concerned that they said things like, in fact, tooth decay is declining globally, and they would deny this now that soft drink consumption is increasing. So we had a fantastic, I can't remember his name, but he was a professor from Queensland University who produced a paper on not just sugary drinks and dental health, but black cola drinks in particular. So the following week, after this ad campaign went to air, the Parents Jury was also a part of our complaint, which is a web-based network of parents. And A Current Affair did this amazing story where they found this man who actually had no teeth in his mouth, and they were rotten from drinking Coca-Cola. He was addicted to Coca-Cola, and he was overweight, and he had some really serious health problems. And Coke started to get on the phone with us then, ringing us up, and we were like, well, we're going to make a complaint, which we did. And it took about a year for that to go through. And it came back with the ACCC saying, yes, we think it's potentially misleading and deceptive, what Coca-Cola are saying. And the story broke that Coca-Cola was telling big, fat, and rotten lies, which was very bad for a big corporation like Coca-Cola to be taken to task in this way. And unfortunately, the legislation was a few weeks away from being passed, because now if they did that same thing, they would be fined millions of dollars. So that was Coca-Cola's first foray, and that was the OPC's first foray into this kind of environment. And we've been having regular meetings with Coca-Cola since, and I'll explain a little bit of why we are becoming so close. Christine Reynolds and I, she has my direct number. And embarrassingly for Coca-Cola, this appeared in April in The Lancet as an editorial, and it did what the food and beverage industry hate. It compared them to big tobacco. And they were said to be behaving like big tobacco because they were taking the emphasis off them as a corporation for having any responsibility for what they were doing, marketing, pricing, promoting, particularly to adolescents and children, and that it was up to the individual to, make a difference. So in this editorial it talked about, and I come from a background in tobacco control, they are doing exactly what the tobacco industry used to do. So they talked about the same tactics. So marketing heavily to young people, using product placement, promoting so-called healthier versions of products with this vitamin water in the US. And they say they have to, stop advertising, stop marketing nutrition-free products to kids, stop using celebrities to endorse them. I don't know if anyone's watched the World Cup, but it's sponsored by Coca-Cola, as were the Olympics. And if the industry continues, the public's opinion of big food's going to follow that of big tobacco and decay as quickly as a Coca-Cola drinker's teeth. And you'll know all about that. So in January last year, we got together Cancer Council Victoria, Cancer Council Australia, Diabetes Australia and the Heart Foundation to work together on a new campaign called Rethink Sugary Drink. And we'd been thinking about this for some time. Quite a lot of work's been happening overseas. It keeps the sort of issue pretty simple. It puts the issue very simply. It's understandable. It reinforces the sort of discussions you're obviously having all the time with your clients. And, we felt it was time. The evidence had built enough around the disease caused by sugary drinks that we felt it was time to act and start a campaign. So this is our logo. We have a website, rethinksugarydrink.org.au, and I'll show a little bit about what the problem is. So we decided to get involved, as I said, because the evidence had grown around the relationship between sugary drink intake, a number of diseases, and overweight and obesity, which is a cause of diabetes, some cancers and heart disease. So it was time for us to dive into the issue, and the partners were all very keen to do something and hoping that they could make a change. Of course, as with most charities, we did it with no money. So we very much relied on social marketing. And since we did the launch in January last year, we've got a number of supporters on board, and we're very pleased to have Dental Health Services Victoria as one of our supporters. So, we've got quite a big voice involved with this, and quite a lot of people who are doing a lot of work in the area coming under one banner, and we're very pleased that the Victorian Aboriginal Controlled Health Organisation has come on board because they have particularly serious health and I imagine dental health problems as well. So what are we up against? Well, we're up against my friends at Coca-Cola, but we're up against this kind of thing. Little Athletics with their sponsors, Macca's and Coca-Cola Amatil. We've got this sort of family type, young people drinking Coca-Cola. We've had the incredibly successful campaign around sharing a drink with your friends with that Name a Coke campaign. So successful that one of my friends, the marketing director at Coca-Cola, has now gone to the EU, and they will run that same campaign in the EU. And that was all about getting young people to drink more Coca-Cola. And there's an amazing Vimeo that you can look up called Under Share a Coke, which talks about how incredibly successful that campaign was, and very much targeted at youth. And then these giant energy drinks, that's huge amount of energy, as in sugar, plus all the fizz and the associated impacts of that. I asked Coca-Cola if they had a position on caffeine in children, and they said no. I thought, how convenient. So our campaign objectives, initially we wanted people to understand the amount of sugar in sugar-sweetened beverages and the link between weight gain and drinking these drinks. We wanted to have a debate about, there's a lot of work going on in other countries around taxing sugary drinks, and you might not know, but quite a lot of the Western Pacific islands have taxes. Fiji, Tonga, Samoa, they have the highest rates of overweight and obesity in the world, but they're really doing some really interesting work. And Mexico has just introduced a sugary drink tax backed by Bloomberg, who was the mayor of New York, who I'll refer to what they've done and how we've used their work. So price is really interesting, and when you talk about a tax on sugary drinks, the soft drink industry goes nuts. So we call that the scream factor. We know we're on the right track if we start talking about taxing sugary drinks. We want people to talk about the availability of sugary drinks, where they're available. You know, going into a health setting and seeing a vending machine with sugary drinks. We had a Coca-Cola vending machine at the Cancer Council. I said, it has to go. We cannot write a complaint to the ACCC on this floor and have the vending machine on that floor. Anyway, for my pain, I had to go and speak to every single staff meeting and explain myself and why we should be doing this. And, you know, it wasn't enough just to say, we don't have cigarette vending machines, we shouldn't have the Coke vending machine. So we did get rid of the Coke vending machine, and interestingly, we had a fruit box up there in that room as well, which was losing money in a charity, which was a bit of a concern. And when we got rid of the vending machine, the fruit box consumption tripled. And it hasn't been in the red since. So, you know, that was a very good substitution. So we wanted a settings-based approach too. So this is something that everybody could do. A family could do, a school can do, anyone can do this. So there's lots of ways you can activate it, which is really interesting. Our target audience was low to middle socioeconomic groups, high consumers, adolescent boys, also high consumers, and household grocery buyers. And our key message was how much sugar is in a 600ml bottle of drink. And to replace these drinks with water, tap water, or reduced fat milk. So I'm going to talk through what we've done so far. We've launched the campaign, a position statement, a TVC, a microsite, a media event. We had a forum last year. We did this frozen drinks PR campaign, which was quite fun. We've done a brainstorm. We've got new partners on board. We've done a comms plan, and yesterday we did a media release with the DHSV. So, our launch. We had given the Cancer Council some years ago with other public health groups had developed an advertising campaign, graphic cigarette ads with that eye and the lungs and, you know, that journey down the throat, and very graphic. But they've gone around the world, and they've been used by New York City, which has a very sophisticated kind of approach to public health. And they said to us, you gave us your smoking ads, we'll give you our sugary drinks ads. So they gave us their ads, just handed them over. And what we did was we changed this advertisement just to make it Australian, and we set up a website, and we made a number of recommendations around policy changes, around tax, around settings, around the sort of work that needs to be done around promotion of these drinks to young people. So a sort of a policy framework as well. And we launched this TVC online, and it got a huge amount of coverage. So that's the website. We've got facts, tips and resources, how much sugar is in particular drinks. It's a great website. So I'm just going to show you that we've got two ads. I'm not going to show you the really grotty, nasty one because we've just had lunch, but there's a man drinking fat ad, but I'll just show you this one. Hang on. Such a great guy. They've got another ad where they show this same guy how far he has to walk off one can of soft drink, and it's all through New York. It's really cool, but we just don't have any money to do that. But, you know, I love him. He's fantastic. So we launched that, and we had this call to action around what we wanted the industry to do. So we wanted a social marketing campaign that this can, we can get paid advertising, that we can get the message out across the board. We wanted the government to introduce tax and pricing options around, really we wanted a tax on sugary drinks, but we didn't say that exactly. We wanted children to be protected from this sort of marketing, particularly through sports, sending really mixed messages to children. The World Health Organisation says kids should be protected from this advertising. Restricting the sale of these beverages in all schools. They're not meant to be sold in schools in Victoria anyway. We've been calling on the industry to pull out of schools voluntarily, but a lot of schools still have sugary drinks, and in Frankston the PNC gets the money from Frankston High School's vending machine. And there's a lot of community sites where these sugary drinks are sold. And we wanted to encourage the reduction of sale of these products in workplaces and things like that. So we had a launch and we did that iconic piling up of all the sugar. And it's really shocking. Solo has a huge amount of sugar in it, and even a tiny little can of V. And I think that was the amount of sugar you'd get in a year if you drank a can of Coke a day, something like that. So we got a lot of coverage of our, a fairly simple idea, really. The media really loved it. This is Beck, our media manager's one of her little twins, who had a great day. It was fantastic. So what happened? We had, not relying on paid advertising, we really had to rely on social media, but we got a lot of coverage. We were really happy. The Rethink Sugary Drink hashtag is very much alive and well. We had a lot of visits to our website. We had 5,500 views of the video. So that was a really, really great outcome. We were very, very happy. Coca-Cola got a bit upset and wanted to have some meetings with us. So we met with them. And I think the strangest thing that happened, it's always strange because they come in with their drink and they pop it down. And then you have the chat. And they try and meet with everybody separately. We just said, you'll have to meet with us all together. And then we said, we haven't got an hour, we've only got half an hour. And then we had quite a quick meeting because they didn't do their presentation. They always bring a presentation. And so they wanted to tell us what they were doing. And we sort of said, well, you know what, you have other drinks other than sugary drinks, No. And we said, well, what about, we've had the evidence, we've had the new dietary guidelines which analyse the evidence around the role of sugar in the diet and said that sugar contributes to overweight and obesity in children and in adults. And they said, well, we don't believe that. It's like, well, we do actually, and that's why we're running this campaign. Because they said, why are you doing this campaign? And, apart from the very obvious dental health issues. So, we had the chat and then we left. So then Coca-Cola did a campaign which they've been running out around the world, around them as part of the solution. And you can imagine how I feel about that. They're not the solution. So they did this commitment, and you might have seen it. They ran little ads. They're doing this bicycle network, and Coca-Cola are doing the happiness cycle. There's a lot of happiness with Coca-Cola. Same with McDonald's, the Happy Meal. I don't get the happiness. Not very happy. So Coca-Cola ring up and say, my friend Katrina Reynolds, the corporate affairs manager, rings me up and says, Jane, we're launching this new thing today with Bicycle Network, but it's fine because there's no branding. The bikes aren't branded. We're doing this thing with teens. And I said, well, and look at them. They look branded to me. They're red and white. And they're doing all this kind of promotion with these young people, influential young teens, to promote cycling. Well, they're really promoting Coca-Cola. And they're doing kilojoule labelling on their vending machines. I haven't seen that yet, but I'm sure they are, but, good on them. And smaller containers. Well, good. And then they did this ad, some more ads about smaller portion sizes, a lot more low kilojoules, transparent information. Oh, seriously? Put how many teaspoons of sugar are in everyone, and help doing the physical activity. So I got together with some of my friends and we did our own We did our own little thing about, we got cancer, diabetes, heart, us, Dental Association, Nutrition Australia, Physical Activity Australia, Parents during the Australian New Zealand Obesity Society. And we said what Coca-Cola should do. We wrote a letter to Coca-Cola and said, this is really what you should be doing. And they did the same thing in New Zealand. And one of my partners from Deakin Uni, Boyd Swinburne, went and met with the managing director of Coca-Cola in New Zealand. And things didn't go as well in Australia as they did in New Zealand. And he said that the media stories in New Zealand when Coca-Cola launched their new campaign were a third for Coke, a third neutral and a third against, whereas in Australia it was 80% against Coke. So I think having the Rethink Sugary Drink campaign made Coca-Cola's efforts look, you know, not as good as they did in New Zealand, where there's been no work around raising awareness of the sugar in these drinks. And I quite like this. This is me talking about weight washing, and there's Coca-Cola bringing you information and innovation. Great. And so, no, I love Coke. And so, anyway, just to keep the vibe going, we had a forum. And we had Mandy Lee, who's a fantastic nutritionist who was very much involved with the dietary guidelines. He knows all about sugar consumption and what people are eating and why it's a problem. We had Stephen Bendel from the YMCA, who's very keen on sugary drinks and getting them out of their venues and taking action. The Department of Health came along and we had this great forum. And then we did a lot of media about it. And it was really fantastic. And we launched, at this one, we launched our Man Drinking Sugar ad, again from the New York City Health Department. And it was called the most shocking ad of the year on Yahoo, and we got 230,000 downloads. So finally one of our viral campaigns went viral! And anyone who's tried to do a viral campaign that has never gone viral, that was very exciting. So I'm not going to show you this ad because it's too gross. I'm just going to move on. What a relief! So, on our website, we've got some other things. We've got, if you wanted to have a vending machine and you want it to be healthier, this is what you would do. We've got a fantastic infographic and people can download that and put it in their canteen or in their workplace. We've got some fantastic information for parents if they want to cut out sugary drinks in their home, workplaces, community centres, that kind of thing. So we want to empower anybody who wants to do something to be able to do it. So we'd really love for you to go and have a look. So I'll just go back to this. This is our version of how far you would have to walk if you drank a sugary drink. So you feed in your weight, where you live, what you've drunk, and then it will tell you from your local GPO in the centre of the city how far you would have to walk. So that's 5 Ks if you drink one sugary drink, and that's how far you'd have to walk it off. So just a nice little sort of way of people interacting and understanding the relationship between the kilojoules that they've drunk and how far they'd have to walk. Then we did a super shocker, frozen super shocker. So those Slurpees have 30 teaspoons of sugar. And we were really blown away. And, oh, an apple. Is that a sign? I'm out of time. I'm probably out of time. Anyway, I'm going to finish up quickly. But we did this. So, and at that stage, Coca-Cola running this thing, $1 for one of these big fizzy things, you know, the Slurpees, and we just worked out, one of my team found all this information on their websites and did a little sort of league table, and the media loved it. So that was just a very simple little, and I had no idea. I thought those fizzy Slurpee things were just full of air and ice. I didn't know they had so much sugar in them. It's extraordinary, much more than an ordinary soft drink. And then yesterday we did a fantastic piece of work with DSHV, who had some data around consumption of soft drink by local government areas. So really giving local councils, writing their municipal public health plans, some hard data and an understanding of where they stood in relation to other areas. So there is obviously a socioeconomic relationship back to disadvantage. So we did that as part of the Rethink Sugary Drink, and there's been quite a little bit of media, mostly in sort of the Leader and that kind of local thing. So what's next? Well, we've got all these partners. We're trying to work out how we work together. We're still doing the same sort of things we're doing. We want to develop more tools and resources. We'd love to do some paid advertising. We're going to really focus on not just not drinking sugary drinks, but drinking water. We've developed a relationship with Vacho, and we're going to tailor an ad just for Vacho, so using Aboriginal people, and doing a radio ad. And we're going to incorporate Rethink messages into health worker training. We want to make tap water more accessible, so we're going to do this. I noticed in Melbourne Sports and Aquatic Centre, which is my local kind of gym, pool, it's very, very hard to find somewhere to get fresh water, but it's very, very easy to find a sports drink or a can of Coke. So we're going to do this thing where we go into big places like that and time people and see how long it takes for them to fill up their water bottle compared to buying a soft drink or a sports drink. And we're going to do something like going to Fed Square, going to the airport, going to Chadstone, just do this little campaign. So that's quite exciting. We're going to do a poster on the health impacts of drinking sugary drinks, which will include dental health. And we're going to try and run some kind of campaign with high schools, given that those kids are such high consumers of sugary drinks. We're going to do some kind of interactive competition. So thank you very much for having me.